So let's be prepared for what may come down the pipe, and let's not be naive. We're not out of the pandemic.
This week, the U.S. launched a COVID-19 test and treat program in pharmacies. If people test positive and are eligible, they can get therapeutic pills on the spot right away. The Ontario Pharmacists Association is hoping to start a similar program here, so we're ready for whatever the pandemic may have in store.
We don't want to be caught in a scenario where we're playing catch up. We have an opportunity to be more forward thinking on this, plan ahead, and get it right.
Currently, only Pfizer's antiviral pill Paxlovid has been approved by Health Canada. It's only available through provincial testing centres based on strict eligibility guidelines, and supply is limited. Ontario Pharmacists Association CEO Justin Bates says as supply increases, a pharmacy program makes sense. Locations are easily accessible and pharmacists are well versed in drug interactions and COVID testing.
This is meant to be complementary, so it's not taking anything away from any other healthcare provider. It's really adding to the capacity so that we can ensure that as the criteria expands, and we expect it will, for those eligible to receive an antiviral treatment, that they have options in the community to be able to get it.
For around 2 months, the association has been talking with the Ministry of Health about how the program might work. Along with education, more pharmacies would need rapid molecular tests. Currently, just 800 in the province are conducting such testing, which is considered to be as accurate as a PCR test. The other big part of the puzzle is allowing pharmacists to prescribe the drug.
Many provinces have enabled prescriptive authority for pharmacists. Alberta allows for the prescribing of anything other than a controlled substance. Right now, pharmacists in Ontario can only prescribe smoking cessation products.
As we look to the future and how to live with COVID, infectious disease Dr. Isaac Bogosh says pharmacy test and treat programs could be an important part of a broader healthcare strategy that would keep people out of the hospital.
For those of us who work in healthcare, I think it's clear that we know and appreciate the role that pharmacists play. Like, they are a major pillar of healthcare provision in the inpatient and outpatient setting. I don't know if the general public appreciates that, and they have a big role to play, and this can be included in their role. I'm really glad, at least in the United States, that they're really being included into the fold of patient care, and I really hope we can do that more in Canada.
Now, we did reach out to the Ministry of Health to confirm if Ontario is looking into such a program in the days ahead, but did not hear back by airtime. We'll keep this story updated on our website, citynews.ca. For City News, I'm Dilshad Burman.